Hello, my name is Corey Erickson, and I am a Provider Relations Specialist at Sanford Health Plan. I want to thank you for taking the time to join me for this quick and informative webinar. This short webinar will help you read and understand check adjustment reports. Here are a few things that I will be presenting on today to help you understand and read a check adjustment report. I'll be going over what it is, how to use it, some additional information, EFT and ERA, and some key takeaways. The purpose of a check adjustment report is to show how your claim or claims are affected by a check adjustment. This can be created through a negative balance, ad hoc adjustment, or a check amount not matching the remittance advice amount. This report is sent to you as a separate mailing from the explanation of payment when the check does not match the amount on the EOP. This is an ongoing report, so you will want to hang on to each check adjustment report in order until the zero balance has been cleared. The image on this slide provides an overview of each section of the report and is available on sanfordhealthplan.org within our provider manual. To help you better understand this report, I will be providing an overview of each section. This section displays check information in referencing the EOP associated with the report. The EOP will arrive a few days after receiving this report. If you would like to view the EOP, you can log on to your secure account on our provider portal and search by check number or claim number. The claim list section displays claims from the EOP or claims from the EOP that are affected by a check adjustment. If there are no claims listed, reference the EOP sent separately from this report. The patient's name, date of service, and claim ID are available for your reference. The negative balance carryover section displays the amount that was applied from a previously paid and adjusted claim. This carryover amount will be shown in the check summary on this report. The check summary portion summarizes anything that affects the check. The claim amount is the total net payable of the claims on the explanation of payment. The negative balance amount is the amount applied to the check. The refunds amount equals refunds that have been processed. The ad hoc amount equals a payment made to make a previous check or checks whole. This amount should be applied to those claims. And the check amount will display the check or EFT total you have received or will receive shortly. The outstanding negative balance claims section will display which claims have been adjusted and the payment amount. These funds should be applied to the claims associated with the EOP in order to make the check whole. If there is a negative balance to be satisfied, you will not receive remittance advice in the form of an EOP until there is some kind of finalized claim activity that applies towards the negative balance claims. Here's an example of a check adjustment report with information in each section. To help you better understand how to read these reports, I have created a short video that walks you through how to read and analyze the information in each section. Here's an example of a check adjustment report that you may receive if you're still receiving paper checks. This adjustment report identifies all affected claims where there is a negative balance, ad hoc adjustment, or check amount not matching the remittance advice amount. As you can see in this top box, it's basically a summary of what this report is. You'll see that there's a vendor name, a run number that's listed chronologically if reviewing more than one of these reports, a vendor ID that's associated with your practice, a checking account number, or not a checking account number, but a checking account, which in this case is SHP. You'll want to ensure that you're not intermingling accounts because these reports need to be specific to each account, as that's the only way to understand and verify the information. So this is SHP. You might see an SGH or an SHP MDX for Sanford Health Plan Medicaid expansion. As long as you're following the same account, you should be okay when reviewing these reports. You can also see that there's a check number a check amount, and a check date. Now keep in mind that there's a check number assigned even though there was no check written. And I'll be reviewing that when I'm focusing on the explanation of payment in just a second. You also see there's a claim amount, an adjustment total, negative balance amount, and a refund amount. Now we'll look at the claims list, and we can see that there's 2 claims received for $57.38 for Cosmo Kramer. We also see that there's a negative claim or a negative adjustment here for $69.01. Now you may be wondering where this is coming from, as there's no explanation and you're trying to figure out why there's a reversal or a recoupment happening. Well, if we go a little bit further down, we can see that there's an outstanding negative balance claims section. These claim reversals will appear in the claim list when the negative balance is satisfied. So in this case, this claim was moved from that section to here because the negative balance has been satisfied by these 2 claims that have been received. Now the sum of these claims and the claim total is $45.75. And you'll see that there's a negative balance carryover of $45.75. You may be wondering what a negative balance carryover is. Well, Sanford Health Plan recoups on future claims and future claims payments. Well, in this case, the $45.75 is not enough to satisfy the outstanding negative balance claim of $69.01, hence the check amount is 0. Now just to review the explanation of payment that corresponds with this particular check adjustment report, we can see that in fact there is no check or EFT number. However, if you were to search 465701, which is the check number that was on the check adjustment report, this is what will show up. You can also search for this explanation of payment on our provider portal using the member ID and a corresponding date of service, as well as claim numbers and the check that's on the check adjustment report. We can see on this report that there's 2 claims for $57.38, a reversal for $69.01, and the adjustment. You can see that the reason that there was adjustment of this reversal for $69.01 was no coverage, or NCVG, and the explanation code is here. Member was not eligible. And I want to point out that on the statement totals, you'll see a payment amount of $45.75. Well, in this case, there was no payment amount for $45.75, so if reviewing your explanation of payment exclusively, it might not make the most sense as to why it says that you're receiving a payment, but the check is for 0. So we'll explain a little further, moving down. So you'll still see that there's a negative outstanding, or there's an outstanding negative balance claim of $69.01. Now, reviewing the next report that you receive, you want to verify that you're still looking at the same account. And you'll see that the check or the run number is in chronological order. And now we have a check number 466203, and now we see a check amount number. We also see a claim amount of negative $11.63. And here is our negative balance amount from the previous report for $45.75. So when reviewing the claims list, we can see that there is no longer an outstanding negative balance claim on this check adjustment report because it has now moved into the claims list. Because the outstanding negative balance claims will appear on the claims list when the negative balance has been satisfied. Well, in this case, it's been satisfied a number of ways. The $57.38 that's received from George Costanza's claim is not enough to satisfy this amount completely, and so the claim total is minus $11.63. However, the negative balance carryover from the previous report shows that there's $45.75 that should be added to the negative $11.63, giving you a total of $34.12 for a check amount. To review that on the explanation of payment, you can see that that 466203 is the check amount, and you can also see the 5738, the reversal, and the adjustment. Also, it states what's happening as to why there was a reversal and adjustment. And the statement total says negative $11.63, and you'll finally see the check for $34.12. Okay, excuse me. So now that we're through that, it's important to note that you need to review the explanation of payment and the check adjustment report to ensure that your reporting is accurate. And keep in mind, if there is a negative balance to be satisfied, you will not receive remittance advice in the form of explanation of payments until there is some kind of finalized claim activity that applies towards the negative balance claims. Also to note, this checking account, SHP, you want to hold on to the check adjustment reports in order, making sure that you're reviewing the same account until the zero balance is cleared. Now that we've kind of gone over a check adjustment report, I wanted to give you one more example that looks slightly different, just so that you have a better idea of how to read these reports. Here we're dealing with a different provider. We're dealing with ABC Chiropractic. Information is laid out similarly. Here's the summary. We can see what's going on. Right away, we can see that there was no check amount, and there's a negative balance amount of $119.90 due to 4 patients. In this claims list, we see 4 patients that have a total of $119.90. There's the carryover. The check summary indicates the same for $119.90, and the check amount was 0. On the bottom, we see outstanding negative balance claims. There's 4 of them. 1 for $190, 2 for $86.31, and 1 for $311.09. So $119 you would think would cover one of these for patient C for $86.31. In some cases, it would pull from the oldest check date on the outstanding negative balance claims. So in this case, the oldest claim is the $190. And the $119.90 can't cover the $190. And so it would make sense that the $86.31 should be in the claims list, and you should have a negative balance carryover of $33.59 from the difference of $119.90 minus $86.31. But in this case, sometimes you'll see where the way that it's processed is the $119 is waiting to pull against the oldest check date or the oldest date of outstanding negative balance claim. So in this case, we have a negative balance carryover of $119.90. So moving to the next report, we can see that there is a check amount. So we can see right away that we have a payment. So reviewing in the list, the claims list, we can see that negative balance, the outstanding negative balance of $190 has moved to the claims list because there's enough here to satisfy that negative claims balance value. And our claim total is $227. Now you may be also wondering at the same note, well, why did the $86.31s, since there's enough in the claim total to cover these $86.31s, both of them, why did it not move up? Well, in this case, still, the $311, there must have been some changes here, multiple adjustments, because now it's $427 of 24. And so in this case, the negative balance carryover is added to the $227 that's in our claims total, and we have a payment to check amount for $346.90, even though there's still 3 outstanding negative balance claims that are out there. So we'll continue to move on here. And we can see on this payment run, there's 1 claim for $0 and 1 claim for $19. And we have a negative balance carryover of $19. The check summary indicates this as well, and there's a check amount of 0. As we can see, there's still 3 claims in the outstanding negative balance claims, and the $19 is trying to pull against those outstanding balances, and there's not enough there to do a recoupment. So we need to continue to move on and wait for more claims to come in. And in this case, we have a check amount of 0 right off the bat. We can see that there was enough claims that have come in our claims list to satisfy the 2 claims for $86.31. And there's a claim total for $111.86 as a negative balance carryover, as seen here, for this particular report. Now, this is where it gets slightly confusing, because the previous check adjustment report had a negative balance carryover of $19, and this particular report has a carryover of $111.86. So when adding those together, you have $130.86. As seen here, you'll see 5663, and that's this particular run number. And the previous run of $19 as a carryover was 5629. So our negative balance carryover, it doesn't look right as far as addition in order, but it's the 19 plus the 111.86 is $130.86. And as we can see down here, we still have one more claim that's an outstanding negative balance claim that's waiting to be recouped for $311.09. Moving on to the next report, we can see right off the bat, there's 2 claims here for a total of $87.24. When that's added, so you'll see the carryover total is $87.24 for this particular report. That's added to the negative balance carryover from the previous report of $130.86. And you'll see that negative balance carryover is now $218.10. However, that $218.10 is not enough to cover the outstanding balance of $311.09 that's waiting to be recouped. So the check amount is still 0. This will be the last report on this particular series of check adjustment reports. And we'll see right off the bat on the summary that we have a check amount of $294, a claim amount of $75.90, and the adjustment total, or the negative balance carryover from the previous adjustment report, of $218.10. So now when reviewing the claims list, we can see that that $311 has now moved up because there's the outstanding negative balance of that claim has been satisfied. And we can see that there was also a payment of $311.09. So in this case, if you're questioning why this is now being paid, because this is 046, which shows the reversal, and this is 047, which is now showing the adjustment to pay, you can check your explanation of payment to review why this is now paying, whereas before it was recouping. So that's basically a wash between these two, but there's also 4 other claims here for a total of $75.90. Well, since this $311 has been satisfied basically by itself, the negative balance carryover is then added when you check your check summary. The $75.90 is now added to the negative balance amount of $218.10, which equals a grand total of $294, which would be on the next, or this next check number 999342. I will now explain ad hoc adjustments, as this topic was not part of the video. An ad hoc amount is a payment made to make previous checks whole. This amount should be applied to those claims. Ad hoc adjustments can tie to one claim, like the example on this slide, or a number of different claims. They can add to a check or subtract from a check to make it whole. These adjustments can happen for any number of reasons. They can occur due to encounter payments for Medicaid expansion claims from rural health clinics, IHS facilities, and federally qualified health centers, just to name a few. If you see an ad hoc adjustment on one of your reports and would like more information, please call Sanford Health Plan and we would be glad to research it for you. I'll now talk about refunds and voids and how they affect the reporting process. You may return an overpayment check directly to Sanford Health Plan. However, the check will only be accepted if the overpayment has not already been offset by other claims within the recoupment process. If there is an outstanding negative balance claim that exists for more than 90 days, a letter requesting payment will be sent to the provider. If an outstanding claim reversal is voided, it will disappear from the outstanding negative balance claims list. For faster payment and remittance advice, I highly recommend signing up for EFT and/or ERA. The ERA process will eliminate the need for check adjustment reporting, as it will post all changes electronically and cover all negative balance situations. Please note that if you would like to sign up for both of these services, it is recommended that you use the same clearinghouse for both EFT and ERA. Here are some key takeaways to remember when reading these reports. You want to hold on to your check adjustment reports in order and verify the account number is the same on each report. You want to review those reports alongside the corresponding EOP, and you're also able to review that the EOP, you can verify the checking account information on the edge of the EOP where it is located. You also want to hold on to the reports in order until the zero balance is cleared. Keep in mind that you will not receive remittance advice until there is some form of claim activity that applies towards the negative balance. This concludes the webinar. I want to thank you again for taking the time to learn about check adjustment reports. I've listed a couple of other educational opportunities on this slide that you may have some interest in viewing. Keep an eye out for these and new educational opportunities under the Webinars and Seminars tab on sanfordhealthplan.org. If you have questions, you can submit them to the Provider Relations email at providerrelations@sanfordhealth.org or give us a call. Thank you again and have a great day.